Good morning, and hope all of you are keeping well. These are really anxious times, and I hope everybody is keeping themselves safe. A huge thank you to Dentistry and FMC for the opportunity to bring to you this webinar on Biomen. It's a smart bioactive glass toothpaste. My name is Dr. Swati Nehete. I'm a senior clinical lecturer in restorative dentistry at Queen Mary University of London, and also a clinical advisor to Biomen. At the end of this webinar, you should have a good understanding of the science and the applications of Biomin Toothpaste. I will be challenging some established ideas on the basis of new scientific understanding. You'll be able to have a detailed understanding of dentine hypersensitivity, early caries, and have a clear rationale for treatment of dentine hypersensitivity and the demineralized caries lesion. I will tell you the story of Biomin and bioactive glasses in general. I'll take you through a few emerging applications of bioactive glasses, followed by the details of the smart properties of Biomin for the application in dentine hypersensitivity, early caries, and the influence of the acidic environment. Now, Biomin is a QMUL venture that we are extremely proud of. Biomin Technologies is a startup company from Queen Mary University of London. It's a bioactive glass material developed from 10 years of academic research at Queen Mary by Professor Hill and his co-workers. Dr. Gillam and Professor Hill hold the patent for the Biomin bioactive glass. And this toothpaste has been developed, but there is work in progress for incorporating this technology into professional dental products. But each of these processes are very lengthy. We are happy with the awards received, especially the CE and the FDA approvals. They've only come in within the last 2 or 3 weeks. Now, it's important to note that the FDA approval is the first in the last 4 years for a product containing any fluoride at all. So, bioactive glasses are an emerging area of research, but it all started a long time ago in 1969 with Professor Larry Hench. He is the father of bioactive ceramics and bioactive glasses, and he produced this not long after his PhD. It all started with a chance conversation between him and a colonel on a bus. Now, this colonel had returned from the war, and he was talking to Professor Hench about the rejection of implants in wounded soldiers. And this allowed him to focus on moving the importance and shifting the focus from bioinert to bioactive. He defined the bioactive glass, and he talked about it as a glass that dissolves in body fluids, releasing calcium and phosphate ions and forms hydroxycarbonated apatite. And it's really important that calcium and phosphate ions are available for forming the hydroxycarbonated apatite. He referred to them as calcium phosphate silicates. He differentiated between ceramics and bioactive glasses in that ceramics are more crystalline in their structure, whereas bioactive glasses are amorphous. But the key element is that bioactive glasses recruit cells and is biodegradable and osteoconductive. And dentistry wanted a slice of this amazing material. So it's being used in several choice applications. As you can imagine, a material that produces apatite or fluorapatite has remineralizing properties. It's been used in research projects at Queen Mary on many areas. And you will see a lot of unpublished data within this presentation. It's been used for a project with incorporation into an orthodontic adhesive. And what they did is they incorporated the bioactive glass, the Biomen bioactive glass, into the composite that is used to attach the orthodontic bracket onto the tooth surface. Now, the fact that this had bioactive glass reduced the cariogenic potential of this bracket by holding on to plaque. And this was all done in vitro, and it has applications in clinical areas. Now, the other area that has been looked at is air polishing. Now, this is a really attractive area, especially for the dental practitioner. There is a pain-free process of removing plaque, biofilm, and early calculus. And the teams at King's have come up with this product, which is silk. And it's Novamin bioactive glass in its pure form. And it is used within a device like this, or an EMS machine, or an aquacut machine by Velapex. And all of these allow the delivery of the bioactive glass directly onto the tooth surface. It shows that it produces a smooth surface with a significant reduction in sensitivity. Now, bioactive glass air polishing, according to the authors, was more clinically and statistically effective at desensitizing teeth, both in groups with good and poor oral hygiene, removing stain, and in the poor oral hygiene patient subgroup, the bioactive glass also provided better overall patient comfort during the procedure. Now, we know this works. There's a lot of empirical evidence amongst the dental community. But we looked at some other areas, and it's being implemented in restorative materials. With the implementation of the Minamata Convention, we're looking for replacing the amalgam restorative material, which has been the mainstay of dentistry for the longest time. Now, composites suffer from shrinkage and marginal leakage, and therefore incorporating bioactive glass into composites lends itself to research, and it has started within certain teams. And Ferrocane, mentioned here, is a big name within this research. Restorative materials are also being used with bioactive glasses, and they're being used in endodontic applications as well. The other area is endodontics. Now, the producers of MTA, that is Angelus, have provided 3 products, which is BioC Repair, BioC Sealer, and BioC Sealer Ion Plus. Now, if you look at how these products handle, these are sealers for endodontic treatment, and BioC Repair is like a putty that you can use for retrograde restorations after endodontic surgery. Colten Rayco has produced Gutterflow BioSeal, but all of these products, both from Angelus as well as Colten Rayco, contain calcium silicates rather than bioactive glasses. Now, I looked at the literature up and down and only found one product, one Japanese product by Nishika. And this product, they say, contains bioactive glass. Now, the details of the bioactive glass itself are not clear, or the composition of the bioactive glass are not clear. So we need to check if this is a bioactive glass or a ceramic. There are other applications for pulp therapy. So there's dental varnishes, and then there's desensitizing prophylactic paste, prophy paste. And these have all got applications within this area. But we're not here to talk about other applications. We're here to talk about these in toothpaste. So Bioactive glass or bioglass was the first product produced. And this is the original bioactive glass, which was developed as a bone substitute. It was never really intended for use in toothpaste. In 1990 and around the 1990s, US biomaterials adapted this to make it Novamin and incorporated it into toothpaste. Eventually, this was sold to GSK, and GSK has enjoyed the success. So, on the basis that this was never originally intended for toothpaste, Novamin has enjoyed an enormous amount of success. Now, Biomen, on the other hand, has been designed and optimized for dental applications. We've added fluoride and phosphate content for improved ability to form fluorapatite. And the particle size is much, much smaller. So Biomen is specifically designed to treat dentine hypersensitivity. Now, whether this dentine hypersensitivity is either post-operative or after restorative treatment or periodontal therapy, or associated with whitening treatment. Whitening treatments are extremely popular at the moment, especially within the younger age group. And we find that there is always post-operative sensitivity. We are aware of a group of practitioners who would always provide Biomin F toothpaste along with the tooth whitening kits. Now, it is also important for remineralization, and this remineralization role is really key in the early caries and for prevention as well as treatment of the early caries lesion. Which brings us neatly to the smart properties of Biomin and the question of fluoride in Biomin. So, what are the smart properties of Biomin? It has a very low abrasivity. The RDA value that we would normally accept is 250. Biomin is a much softer glass, and therefore at 68 it is a very low abrasivity toothpaste. The fluoride within the glass is released over a 12-hour period. Now, this is one of the key features of how we look at the use of fluoride differently within the Biomen particle. The average particle size is 6 microns, which allows entry into the dentinal tubules. It promotes apatite formation as fluorapatite, and it causes dentinal occlusion. Now, this occlusion improves symptoms of dentine hypersensitivity. Once it goes into the dentinal tubule, fluorapatite is preferentially deposited, and it's preferentially deposited in acidic pHs, and therefore promoting remineralization of the early caries lesion. And this fluorapatite is resistant to acid challenge. But what about fluoride? So let's look at some of the seminal work. Fluoride is the mainstay of prevention and management of caries in modern dentistry. It's been used as toothpaste, mouth rinses, fluoride treatments, professional applications, and daily use at home of high fluoride treatments. COVID-19 is going to force us to review dental practice in favor of preventive and minimally invasive dentistry. Now, Queen Mary provides a course for minimally invasive dentistry if it is of interest to you. But going back to fluoride, when it is in the oral cavity and when it is within the oral environment, it interacts with enamel to form more acid-resistant fluorapatite. And this modifies the behavior of cariogenic bacteria within the plaque biofilm to reduce the metabolism of sugars. If the metabolism of sugars is reduced, there's less acid, and therefore less demineralization, and therefore less caries. And yet, BioMin toothpaste contains 530 parts per million of fluoride. So how do we justify this? So let's look a little bit at the dental literature that endorses high fluoride containing toothpaste. Now, this is a seminal piece of work by within the Cochrane database. And this is an update of a previously done review. This review, in this review, the authors who looked at the use of this toothpaste in adolescent patients or users concluded, and I quote, that for many comparison of different concentrations, the caries preventive effects are absolute. And our confidence in these effects estimates are uncertain and could be challenged by further research. Now, further research is exactly what we are providing here. At Queen Mary, there was an original paper published on the correlation of salivary content or the salivary concentration of fluoride and fluorapatite. So they looked at these and they found that at higher concentrations, above 45 parts per million, within the oral environment, the fluoride becomes not bioavailable and it precipitates as calcium fluoride. But below 20 parts per million, it precipitates fluorapatite in the presence of calcium and phosphate ions. So we looked at the interaction between saliva and fluoride. So at normal salivary flow rate, the soluble fluoride is reduced by half every minute. Let's extrapolate this for 1450 parts per million. Now, around the world, we know that the accepted fluoride concentrations differ. But in the UK, the Oral Health Toolkit tells us that we should be using a minimum of 1450 parts per million of fluoride. So let's extrapolate this data. For every minute, we halve the amount of percentage of parts per million of fluoride. So by about 90 minutes, there's no therapeutic level of fluoride remaining in the mouth. So even if we use a high concentration toothpaste, it affords you only an extra couple of minutes of exposure to that fluoride. Now, it is used quite often when the salivary flow rate is lower, like when you're sleeping and the salivary flow rate is lower. And this will improve contact with the tooth surface. But essentially, we need something that is smarter at maintaining the fluoride concentration at that critically low level over a period of time. Now, we know that the Biomen molecule or the Biomen particle dissolves over 12 hours. And we looked at some work done by Professor Ten Carter. And this really takes me back to my histology undergraduate days. Now, he recognized that for treatments to be effective longer than the brushing and the salivary clearance, fluoride needs to be deposited and slowly released. So the two key words here are it needs to be deposited and slowly released. Now, Biomen F potentially does exactly this because it releases fluoride at a low level for a long period of time. So we looked at some of the work by looking at this bioactive glass in a neutral solution. Now, it slowly dissolves, and if you look that over a 12-hour period, it releases fluoride, but the fluoride drops. And as the fluoride drops, quite a bit of this fluoride is taken up for fluorapatite formation. but there is a little bit of excess fluoride. So we now know that there is a concentration of fluoride that is maintained over 12 hours, as well as it stays in the mouth for that duration. But how do we know that it stays there? How does it get deposited? So this toothpaste contains a small amount of polyacrylic acid, which is the same acid that is used in glass ionomer cements. So we know that the polyacrylic acid polymer attaches chemically to the calcium ions in the tooth surface with double bonds. And this polymer then also attaches to the calcium in the Biomen particle. It gets attached onto the tooth surface and prevents the Biomen particle from being washed away. Now, once this is attached, the Biomen particle slowly dissolves, releasing calcium, phosphate, and optionally fluoride ions over the next 8 to 12 hours. This accelerates formation of fluorapatite. And for the formation of fluorapatite, we need calcium, phosphate, and fluorapatite ions, and we need all three of those. But we know that local factors affect salivary flow rate. They affect salivary flow rate by systemic factors, they're affected by local factors. But we're talking a little bit about the local factors here. So we have an area here where we have the influence of acidic pH. The effect of pH is one of the smart features. The bioactive glass is designed to dissolve faster when the pH is lower in the mouth. So when you have an acidic attack, say a drink of an acidic drink, this Biomen particle dissolves faster. It raises the pH, releases calcium and phosphate ions, and protects the tooth against acid dissolution. So it raises the pH, so it takes up the hydrogen ions and releases calcium phosphate and protects the tooth. So from an acidic pH, it's now a basic pH. The early caries lesion presents an acidic environment which favors the Biomen dissolution for demineralization. But how does it help with dentine hypersensitivity? Well, this really comes down to the particle size. So the Biomen particle is optimized for size to allow entry into the dentinal tubule. It is softer than the Novamen particle. And here is the critical detail. More than 50% of this toothpaste particle size is small enough for entry into the dentinal tubule. It's smaller, therefore it feels less gritty, so you've got a lovely smooth paste. It reduces the abrasivity, so keeping the RDA value low, and therefore has better dissolution kinetics. Now, when this particle enters the tubule, it attaches along the lovely apatite-rich walls and lays down peritubular dentine. This lines the tubule circumferentially and is seen as a collar on SEM sections, and we'll see those in a couple of minutes. Now, as it adds on the internal surface of the tubule, it reduces fluid movement within this tubule. And whenever we talk about fluid movement within the dentinal tubules, we have to think about Branston and his hydrodynamic theory, which was proposed in 1964. Now, As you will all remember, there were 3 theories for dentine hypersensitivity, but we're going to focus on the brainstem hydrodynamic theory because of writings by Dr. Gillam, who has written that currently the most accepted mechanism of intradental nerve activation associated with dentine sensitivity appears to be the hydrodynamic theory. Although alternative mechanisms of transmission, so direct ionic diffusion, cannot be ruled out, recent investigations in animals, however, appear to provide evidence substantiating the hydrodynamic hypothesis. So we're looking at this as the main focus for this point in time. So I'm going to tell you a little bit about how this came about. In 1964, brainstem was part of an original trial, or initiated an original trial, where they were cutting off cusps of premolar teeth destined for orthodontic extraction. Now, this cusp was subjected to dry filter paper and filter paper soaked in isotonic solution, and the pain response was documented. Now, brainstem attributed the dehydration initiated by the fluid movement as the cause that elicited pain. We use this theory to substantiate the application of this product in dentine hypersensitivity. So we looked at reduction in vitro fluid movement after brushing. So the fluorapatite that occludes the tubule also reduces the fluid movement, resulting in appetite. What is interesting is that although there is occlusion and reduction in fluid flow after brushing, this is increased ever so slightly after an acid challenge. And I'm hoping the SEM images go some way to explain this. So here we have in vitro images of a mid-coronal section of dentine. You can appreciate that this is before brushing. Now this is brushing for a minute in vitro and an hour in artificial saliva. And you'll appreciate that there are these collars of fluorapatite formed on the orifices of the dentinal tubules. These samples were then exposed to 6% citric acid. And after these were exposed to citric acid, there was a little bit of dissolution of this fluorapatite. However, what it did is it occluded, this fluorapatite ended up occluding the canal orifices of the dentinal tubules. And therefore, it promoted and accounts for the additional loss of fluid flow hydrodynamics. So we compared the fluid movement data from this last slide with teeth treated with other market leaders. And you will see that the in vitro data shows a clear advantage to using Biomen F. Thankfully, our scientific data is supported by several published papers, which you can check on the Biomen website. I'm going to pick out 2 specific trials which have looked at dentine hypersensitivity specifically. And Dr. Gillam was involved in setting up this protocol. This novel development opens up a unique opportunity in prevention and management of dentine hypersensitivity and may also be beneficial in preventing acid erosion of the tooth surface. And remember, it raises the pH as it dissolves, therefore it does have an anti-erosive element to its application. And in the maintenance of oral hygiene by reducing the effects of plaque accumulation and gingival inflammation. So one of the side effects is that you get a smoother tooth surface because of the appetite formation. And then there is this other study that was done and published, which says Biomen provides a better treatment response for the treatment of dentine hypersensitivity because of its early onset of action in relieving hypersensitivity as compared to other dentifrices. And all of this clinical data and scientific data is available for you, so please visit the web pages. These include the remineralization of the early caries lesion. Now, the remineralization of the early caries lesion really focuses on the white spot lesion. And white spot lesion is defined as a subsurface enamel porosity from caries demineralization that manifests as a milky white opacity. They are one of the most adverse effects of fixed orthodontic treatment. But it's not just seen in orthodontics. We as dental practitioners see it all the time. And although the focus is always on prevention and conservative management of all patients, this is going to be coming into sharper focus as a result of the COVID-19. Okay. Now, I looked at whether there is any shift in the way we look at caries. And the FDI has a live white paper on the prevention, which is a summary of the current evidence and key issues in controlling this preventable disease. But it really talks about prevention and management of caries. And the FDI World Dental Federation supports a shift in caries management from restorative treatment to measures that will arrest and prevent caries developing, including monitoring, following the concepts of International Caries Classification and Management System. They talk about the caries continuum, and they put the subclinical caries, initial caries, and moderate caries up to the middle here, all in the remineralize and arrest categories. So up to the non-cavitated parts, they would like us to manage this in a remineralizing and arresting means. And once it's cavitated, and you'll see that this particular tooth has partially cavitated. So from moderate to severe caries with cavitation is all for restoration. And this is echoed here. So no tissue removal for both the initial to moderate active or inactive caries lesions, as well as moderate to severe inactive caries lesions. So the only point when they say we need tissue removal, they also talk about it being minimally invasive, okay? So this forms part of a live document that is produced for the FDI World, which you can check out at the fdiworld.org. It is a British author or UK author who has produced this document, and therefore we are likely to see more of this coming into UK practice. Now, we all have firm favorites when we manage our own patients with caries and lots of remineralization required. And the firm favorite we recognize is tooth mousse. And tooth mousse is popular amongst orthodontists as well as dental practitioners who help with younger patients, as well as patients who have suddenly started to get a lot of new caries. So we compared Biomen F to tooth mousse. Now, MI paste is tooth mousse, and MI paste plus is tooth mousse with fluoride added into it. So the four categories we looked at are Biomen F compared to the tooth mousse, and this is artificial saliva. And in the lab, we compared the remineralization with Biomen F, and we saw that tooth mousse is pretty impressive. What was less impressive is that the fluoride version of tooth mousse was only marginally better than the artificial saliva. But we like seeing clinical evidence and we like seeing that things work. So, similar to the evidence and the clinical studies, we have an early adopter of Biomen for application in dentine hypersensitivity as well as white spot lesions. Now, Dr. Stefano Danieli has monitored these two patients over a significant period of time. And you will see these are regular photographs and these are photographs with polarized light. And you can pick out this as an area with a lot of demineralized white spot lesions and a significant reduction in the follow-on, which is about 6 to 8 months. Now, the second case here is a lot more dramatic. And if you look at the areas, there's 1, 2, 3, 4, 5, 6, 7 areas. And if you compare that to the post-op between July and December, which is a really good result, there's reduction in at least 4 or 5 areas and significant reduction. And we thank Dr. Danieli for his slides. So it's available for children's use. This is a new kids range. It's available in fruit flavors, in strawberry, melon, and it's available as a mint flavored toothpaste for adults. Now, there is a fluoride-free version called Biomin C, and I'm going to summarize. The Biomen F is the only toothpaste which can deliver low-level fluoride for an extended period of 12 hours. Fluorapatite is only produced at relatively low fluoride concentrations. Insoluble calcium fluoride is produced predominantly at salivary fluoride concentrations above 45 parts per million. Biomen F is the only toothpaste which can deliver calcium, phosphate, and fluoride to produce acid-resistant fluorapatite continuously. It's the only toothpaste which produces acid-resistant fluorapatite within dentinal tubules, which reduces fluid movement in dentine for improvement in dentine hypersensitivity. So really, less is more. 1450 parts per million of fluoride is being recommended, but undergoes rapid dilution after brushing. Biomen presents an innovative means for release of fluoride and contains just 530 parts per million to be effective. It's important to note that only with adequate supply of both calcium and phosphate ions can remineralization occur, and Biomen provides calcium, phosphate, and fluoride ions. Fluoride alone is insufficient on its own. Minimal intervention dentistry is here to stay in the wake of COVID-19. So we have lots of patients who will need interventions to reduce caries. Now, it's important to understand that this is a new and innovative concept, and it can take up to 15 years for a novel scientific idea to become accepted and common practice. And we're hoping that this goes a small way to allow us to introduce this on a much larger scale, and hope that in the next Cochrane review, Biomen at this low concentration gets endorsed. Now, thank you so much for listening, but it's not possible for any such novel idea to take hold unless there's an enormous effort by an extended research and development team to bring this product to fruition. And it's really, really important for me to acknowledge this. So not only is this a thank you for all of you for listening, but this is also a huge thank you for the extended research and development teams. Thank you for listening, and I'm happy to take questions. So thank you for the questions that have been posted, and I hope you enjoyed the webinar. So there's a question about the RDA value for BioMin Toothpaste for the fluoride version, the Biomin C version, and the kids version. And yes, the RDA value is low. It's 68 for all three of those versions of the toothpaste. So thank you for that question, Lay Hunter. There's another question by Professor Balarani, who has asked about how useful it is to restructure and restore the enamel. I hope your question's been answered by the slide that demonstrated the way in which the polarized pictures were actually very, very clear in showing the clear improvement in the demineralization of the tooth surface. So thank you. That hopefully answers your question. We have had quite a lot of interest with orthodontists to use this. Now, I know that it's quite a popular choice for orthodontists to provide BioMin tooth mousse. And in comparison, we found that with patients post-operatively, BioMin was a lot better. Now, there are some clinical trials in the pipeline, and hopefully you should see that data coming through not too far in the future. So thank you for the question. I hope that answers the question. Thank you very much for the comment about good coverage. Has it been used for sensitivity associated with molar incisor hypomineralization? Thank you, Mr. Rushworth, Mrs. Rushworth, for that question. We haven't looked at specific applications just yet. What you need to appreciate it is that it is in the early stages of research for clinical applications. So we have a fair bit of work going on, and please, if you do have cases of molar incisor hypomineralization, please use the toothpaste and communicate to us if it has been useful for your patients. So thank you for your question, and I hope you can contribute by telling us if it has improved. I see no reason why it wouldn't improve, and therefore I think it would be a promising application. If Biomen is so effective in getting into the dentinal tubules, then do the hygienists at Queen Mary use it regularly as their first choice of prophy paste? It's not available as a prophy paste just yet, but we have lots of early adopters at Queen Mary of this particular toothpaste, and we do give out samples at Queen Mary for our patients. So it is available as samples to our patients, but it's not available in the prophy paste form just yet. But watch this space. Okay, so Imta Zarina is asking a question, and the question is, I've had some patients whose teeth have become more sensitive after Biomin toothpaste. Any ideas why? So it's not a completely undocumented empirical bit of evidence. So we've had some patients who've also said that. We need to look into why that happens, but if they push through the initial increase, very slight increase in sensitivity immediately after using it, the overall improvement in dentine in their sensitivity is much greater than with any other toothpaste. So although we have had patients reporting that, we've had patients coming back and saying, well, actually, although it initially was like that, it did have a significant improvement following on from it. Um, there is a question about the cost of the toothpaste, and I think I will let you go onto the Biomen website to look at any questions relating to marketing. You've got a question about from Mrs. Tavares, is the Biomen C as effective in caries control as Biomen F for a patient with large restorations and who doesn't want fluoride in their toothpaste? Thank you very much. This is a very important question, and the way the Biomen molecule works is, instead of producing fluorapatite with the Biomen C, it produces chlorapatite because it contains the chlorine molecule. And we have some really good in vitro data to say that it would work quite similarly. And in fact, the comparable data is, very comparable. So I think you can use it without any hesitation whatsoever. So thank you for that question, Mrs. Tavares. Please provide more information on minimally invasive dentistry. Thank you. If you go on the Queen Mary University of London website, there are lots of pages on that, and you can look at those. Thank you for your interest. Would it be so? How does Biomen C work if there's no fluoride? Biomen C works because the fluoride has been replaced by chloride, and it forms chlorapatite, and it works in a much more similar manner. There's questions about dental suppliers. Please could you contact look through the web page, and that will allow you to acquire the toothpaste. Is this a prescription only toothpaste? No, thankfully, because it has such low fluoride content, it isn't a prescription only toothpaste. So it's available to purchase freely. Where is the toothpaste available? Any samples? Please contact through the web contact page, and we will make sure you receive some samples for your practice. There are some anecdotal positive comments re MIH. So if that helps, this is to come back molar incisor hypomineralization. So I've got here with me the CEO, Mr. Watley, who has said that there are some anecdotal positive comments about molar incisor hypomineralization. So hopefully that is reassuring for you to try the product with your patients with hypomineralization. Can you use Biomen on babies' teeth? We would use Biomen the way any normal toothpaste is used. So when you are comfortable using toothpaste on a child's tooth, you should be equally comfortable using Biomen and any of the range of the Biomen products. Thank you very much, Dominica, for your kind comment about a good lecture. There are some Australian dentists using it for the application in molar incisor hypomineralization. Is this toothpaste available in the United States? Yes, Dr. Martin, this is available in United States. Now, depending on where you are in the world, maybe the name of the product is slightly different, but if you look for the details on the
web page. It will tell you what the product is called in your country, as well as how you acquire, whether it's samples for dissemination to your patients, or it's any actual sales. You should be able to acquire those toothpastes. Is there any risk of fluorosis in developing teeth with increased or sustained levels of fluoride? If you think, so this is a question from Mr. Chauhan. He's talked about so the long 12-hour release of fluoride, and if there is a risk of fluorosis, because it is way under the 1 part per million concentration. The risk is really low, and it actually minimizes the risk even further. And we have looked at this a little bit, but so I feel fairly reassured in saying that the risk is low. How about advertising? So there's a question by Dr. Papanika, who's asked if we can advise patients to use it as an overnight treatment. So some of the work that's being done, especially by in clinical trials with post-op after orthodontic treatment, patients are being given sort of sleeves or retainers to leave a little bit of toothpaste in. We wouldn't leave it overnight, but leave it for a little while before you go to bed. It'll be adhered onto the tooth surface, and then you go to bed for the rest of the night. So the salivary clearance is a lot lower at night, so hopefully the patients will benefit. There's a little bit of work, and there's trials in the pipeline, so you'll have to watch this space for more evidence to come through. Thank you, Mrs. Salvi, for your comment about a great presentation, and thank you to all of you who've asked for, who've said thank you about the presentations. The chlorapatite, so there's just a little bit more detail about the chlorapatite that is formed in Biomen C. Now, the chloride is incorporated to form chlorapatite, and there will be an immediate ion exchange of that chloride. So the chloride doesn't stay, so it switches back to hydroxyapatite. So although it does form chlorapatite, it switches back to hydroxyapatite quite quickly in the presence of all the right ions. So the next question is by Ms. Scott. Is it recommended to be used whilst teeth whitening, or will the whitening results be reduced due to Biomen blocking the dental tubules? So this is a really good question, Ms. Scott. You're asking about tooth whitening, and tooth whitening, it's an interesting side effect of using Biomen toothpaste. So because you have a much smoother surface because of the uptake of the fluorapatite, which is more acid resistant, you get a very marginal brightening effect using this, although I can't prove it scientifically, which is why I haven't included this in the presentation. But yes, you can use it while using whitening treatment as your regular toothpaste, and it shouldn't detract from the actual whitening. The mechanism of the whitening product is very different to the blocking of the dental tubule. So you should be able to use both at the same time for reduction of dentine hypersensitivity during the use of the whitening products. There's another question about molar enamel hyperplasia by Mr. Patel, who says, can a 10-year-old use it? There is a kids range as well as an adults range. The kids range is mainly differentiated for flavor, and there's the Binosaur logo, the product concentration of fluoride is exactly the same, and the product can be used by all ages. So thank you for your question. Thank you for the kind comments. Overnight treat. So there's just to go back to the point about using it in sort of retainers or trays. You can do this, but because there's a little bit of surfactant in the toothpaste, we ask for you to take it out of the mouth before you go to bed, but you can leave it in there for a little bit. There will be a new product coming on the Biomen range, which will called Progel, which will be much more suited to this application. So please watch this space. And there is a little bit of more detail about the whitening and bleaching, and there doesn't seem to be any evidence to indicate that there's any reduction in whitening as a result of using this toothpaste. So please use the toothpaste in confidence for the effect on dentine hypersensitivity associated with bleaching. So I would be able to reassure you on that. It's a really important question by Mrs. Catcher, who says, how about people with immune system deficiencies? Can they use it? Generally, people or patients in the hospital setup, we would ask patients with immune system deficiencies to use a non-SLS product. So when we do come with the Progel, which will not have the surfactants in it, I would recommend you go with that rather than something that contains a surfactant. The tissues are just too fragile, and therefore it would be better to go with a non-SLS product. There's lots of thank yous and kind comments, and thank you. I haven't received any new questions. If there are any questions that have gone unanswered, can you just please post them back, and I'd be happy to answer those. I'm very grateful for the response that we've received, and I'm really sorry we had to switch because of network issues. So you might see my name come up as someone else. But I hope you all enjoyed the seminar, the webinar, and I hope you are all able to share this new knowledge and novel idea with your patients. Of course, the sort of traditional spit no rinse, and you know, all the advice that you would say. The additional bit of information is when you use the toothpaste, you really need to make sure it comes in contact with all of the tooth surfaces. So get the patient to really swish the toothpaste around, spit, and then without rinsing, our nighttime use is really recommended. There are a few more comments. Thank you very much for your kind comments. So Dr. Undre says, why can you not leave the toothpaste overnight? So Mrs. Undre, the real issue is because it contains a surfactant or SLS, we would recommend that it would cause gingival irritation. So we would leave it in, but then also take it out for a little bit and then take it out and then go to bed. We wouldn't leave it in overnight in a tray with the surfactant. And as I mentioned, for patients with immune deficiencies, we would normally use a surfactant-free toothpaste or SLS-free toothpaste. I hope that answers your question, Mrs. Andre. Thank you for the really kind comments. And just to give a little comment on the gel trays. Whitening treatment, it's really quite nice to use the Biomen straight after the impression tray impressions have been taken. So thank you very much for the kind comments. There's lots of really lovely comments. So really thank you. It's known that, so there's a question by Dr. Mughadam, who says, it's known that fluoride in sediment will eventually be ingested. Could you please explain how this can have an impact on remineralization of the enamel surface? So the Biomen particle gets attached onto the tooth surface and it releases the fluoride within the salivary contents. Now, the saliva contains calcium, phosphate, as well as the fluoride ions. And because the tooth is swimming in this fluid, this salivary mesh of ion-rich field, they take up this and you form fluorapatite. Now, a portion might be ingested, but it's about increasing the amount of contact with that ions to facilitate that ion exchange for fluorapatite. I hope that answers your question, Dr. Mughadam. Thank you. Really, really kind comments. Thank you very much. I hope that's been useful. So please feel reassured to advise your patients to use this toothpaste, and hopefully you will all request samples so that you yourselves can use them to sort of feel reassured before you pass them on. So it has applications in dentine hypersensitivity. Please use them for your whitening patients. They will definitely benefit. Like one of the questions here, there is a small percentage of patients who will talk about a little bit of increased symptoms, but they settle down rapidly after that. So we should feel reassured to advise and recommend this in a very reassured manner. So thank you.